NIATx really started from an idea of Victor Kaposha and an idea that was quickly supported by SAMHSA and CSAT that processes and systems are a key component of addiction treatment. And so the vision there is okay, within general healthcare, within industry, that there's a lot of good process improvement work happening. Could this work within addiction treatment? And it was truly a question of whether or not it could.
The issues that were happening in the field were that the vast majority of people that need treatment didn't get it. So access was a huge issue. The other thing that was really happening is that once people finally found their way to treatment services, they didn't stay very long because it was the process of getting into treatment was so cumbersome and burdensome for them.
And so our initial grant in this through the Past Recovery Program that came out of Robert Wood Johnson Foundation and the STAR program that came out of the CSAT and SAMHSA was to test that can the process improvement methods that are being used in general industry and within healthcare work within addiction treatment services.
Basically, we're trying to get people to get into treatment easier and to get them to stay in treatment long enough for it actually to have an impact on their lives.
I needed help right away, and at the time there was denial and a reluctance to get help, saying I don't have a problem, I don't need to be here.
When they call you, that means they're motivated. There's something going on at that moment that they need to be here. And we need, as an institution, we really need to make strides to get that person in our facility as soon as possible to help them with whatever their problems are at that moment, because it will reoccur.
At times we had a waiting list for residential treatment.
We found out we had about 32% of our clients weren't even showing up for our appointments, which was unacceptable. When you equate that in a business case and you do the numbers, it was phenomenal.
So as we began the NIATx program, we really looked at evidence-based practices around innovation, adoption, organizational change. And one of the practices we found to be very important is for people to be able to implement things simply and quickly.
Historically in this industry, people have, they bring big change and it's some huge thing from outside that gets imposed on an organization. And what's really different and really, I think, powerful for these agencies is this idea of we're going to try something for a day or two or a week or two and see if it works. And if it doesn't work, we're not going to keep doing it. And if it does work, then we're going to broaden how we do that.
People tried that. They started to see, hey, we can make change. It doesn't have to be complicated. And then as they started making these small changes, big results started to happen.
First Change Project was a no-show, to eliminate no-shows. I myself made some ghost calls. I made 5 ghost calls to the center, and I found out that all 5 people were giving out different information. The clients on the other end were hearing different things from different people.
We have control over a few things right now, and that's every phone call that we get, and how we treat people when they get here.
We stopped the project at that point and realized we need to do something right now. So what we did was we manufactured a script and did a staff-wide training, and this is the script that all the staff would start utilizing.
The training was about using the person's name, thanking them for calling, letting them know what's going to happen when they come in for the appointment, and then thanking them for calling. It's just being appreciative that they called the facility.
What that did was help build rapport, because we're trying to develop relationships, because that's really what this is all about, developing a relationship with our clients. Because without that type of relationship, it's going to be difficult to help them in their needs.
I was made to feel like a person, a human being. People cared when I came here. And that's what I needed, because at that point in my life, I didn't have a lot of self-worth.
The no-shows dropped. We engaged people quicker. So we were operating at full capacity for the last 5 years.
What happened was, I think, to everyone's surprise and appreciation, was that the principles there worked very well in addiction treatment. And so we developed another round from there that included another 26 organizations, and then really the word started spreading. of how well it was working, and states wanted to get involved, and one thing led to another, and now we've touched nearly 3,000 organizations.
It makes me feel confident because I have a master's degree, but they don't cover this in school. They don't cover working through the unknown. They don't cover working through the fear of the future, or fear of possibly laying somebody off. They don't teach you how to retool a whole treatment program, a whole billing system, how to do marketing. And I guess a big part of the confidence is it will be extremely overwhelming because there's so much to do. And with the tools that NIATx provides, I can get things done in more of an orderly fashion.
Rather than having to go off and get an MBA and spend 5 years in school, we give them really the basic skills that they need in order to manage their business better.
What I'm most proud of, and it's a recurring issue, is I mean, even this week I was out in Cincinnati listening to people tell their story about the changes they've made, and you just hear over and over how the NIATx model just naturally works for organizations. And then when you listen to the management, being able to say, yeah, we're not only providing better care, but also our organization is stronger now, whether it's financially or clinically. And that, I mean, so that's what I'm most proud of is when I hear those kind of stories, which thankfully, through NIATx that happens on a regular basis.